The one positive take from all those cases is that there was one in hotel quarantine and the balance were from existing known clusters or existing known contacts. So the fact that there isn't a new stream of outbreak is reassuring at one level, but I still want to state that the state is on high alert. Please, whether or not you live in a community which has had cases or not, we want everybody to think seriously about what they're doing over the weekend to make sure you avoid crowds, make sure you avoid putting yourself in a situation which will compromise your health or those of others. Think about the number of people you're having into your home. We know from the health advice, we know from what's happened elsewhere, the highest risk activities are those inside your own home or those inside a confined space, such as a hospitality venue, and that's why the restrictions from Friday address those issues. The businesses involved have had a whole week to get themselves ready, so there is absolutely no excuse. My conversations with the Police Commissioner and with the regulators is please make sure you throw the book at anybody not doing the right thing. Everybody has had ample notice, and that includes patrons as well as the businesses themselves. We've been very considerate in giving people time to adjust, and there is no excuses from Friday. Everybody knows very clearly what the government's message is, what the advice is, what the health advice is, and we expect everybody to comply. But I do want to thank again literally the thousands and thousands of people that have come out to get tested in the last week, especially those who've come forward to get tested in communities which previously didn't have any cases, in regional areas and also parts of Sydney, who until this point in time didn't have community transmission at the level we do. So that is heartening, and I want to thank everybody for doing that. And the next level of compliance, in addition to being vigilant on getting tested, is of course to make sure you stay home for 14 days. This isn't new advice, but it's important advice, because we know the virus has an incubation period of 14 days. So even if you've tested negative initially, but you've been exposed, you've been in a venue where someone with the virus has been, if you've been directly exposed and the health advice is for you to stay home for 14 days, please stay home for 14 days. That's why our hotel quarantine system has worked so well, because you test people early on, they may not have the virus, you test them on day 10 and they do have the virus. And it's so important for that 14 days at home. If you've been asked to do that, please make sure you fulfil that, because otherwise you'll be compromising the health of your family, of your friends, of your loved ones, and more broadly, the wider community. And in particular, to people who are more inclined to socialise than others, please know that even though you may not feel the virus can impact you, although it can, you could be taking it home or giving it to a loved one and then unintentionally causing grief on so many levels. So our message to the community is, firstly, thank you for getting tested. Make sure you keep the testing rates high. The mildest of symptoms, you should get tested. Secondly, if you've been asked to stay home for 14 days, make sure you do. Make sure you consider what you're doing over the weekend. Avoid crowds. Make sure you're COVID safe at all times, and make sure you're taking that extra level of caution. Can I say, in the most strongest way that I can, that the next few weeks are the most critical in New South Wales since the lockdown earlier in March and April. This is the most critical time for our state. If we manage to get on top of the community transmission at this stage, we have a much better chance of continuing to move forward in a positive way. But the next few weeks are critical. We are not out of the woods by any stretch, quite the opposite. I hope I'm not taking words out of Dr. Chant's mouth, but both she and I remain concerned about the next few weeks. We will remain on high alert, and we have some level of anxiety as to the extent of community transmission, and that's why it's important for all of us to play our part, whether we're a business, whether we're a patron, whether we're a member of a family. That pretty much includes everybody in the state. So all of us are on high alert. All of us have to be aware of our own actions. But I want to thank everybody, because in other parts of the world, indeed in other parts of Australia, community transmission isn't followed up as much as it has been here in New South Wales in terms of the contact tracing and the experts that have been on the case, and I want to thank each and every one of them. But there is a limit to their ability. It also is up to each of us to make sure we're doing the right thing. We know what the high-risk activity is. We know what the health advice is, and it's up to all of us to accept it. And even since announcing the extra restrictions on venues which come into effect from Friday. I'm still not seeing the level of compliance that I want to see from patrons and also from the businesses themselves, but that will change on Friday, because any business that doesn't do the right thing will have the book thrown at them, and if we don't find them ourselves, we expect members of the community to let us know, and or staff members for that matter. I know that there are many staff who are concerned about what happens in their workplace. Let us know, and we will come down hard on those people not doing the right thing, because there is so much at stake and so much on the line for the next few weeks. But again, my deepest gratitude to everybody involved in containing the spread until this point. But our job is far from done. We remain on high alert, and I just ask everybody to play their part over the next few weeks.
So there were 16 new cases of COVID were diagnosed in the 24 hours to 8 p.m. last night, bringing the total number of cases in New South Wales to 3,425. There were 18,465 tests carried out in the 24-hour reporting period. There are 91 COVID cases being treated by New South Wales Health, with 2 in intensive care and 1 is on ECMO. Of the 16 new cases, 3 people were associated with the Crossroads Hotel cluster, who are close contacts of known confirmed cases. 11 people are associated with the Thai Rock restaurant cluster, and these include 1 man in his 60s from Hunter, New England, who is a close contact of that case. 1 person from Western Sydney, who is a close contact of a previously reported case that is not associated with any known cluster, was also identified, and there was 1 case in a returned traveller in hotel quarantine. There have been no additional cases associated with the Batemans Bay Soldiers Club cluster. Investigations are continuing, as we haven't identified the source of that infection in that circumstance, but I would like to thank the Bateman Bay community for turning out in high numbers. So that action of that community gives me good assurance that we're not missing any undetected community transmission. The results of that testing will flow through today, yesterday and today, and in coming days, and that will give me a high degree of assurance that the Batemans Bay community, we don't have community transmission, but we all are very watchful there. There are now 53 cases associated with the Crossroads Hotel cluster, and 37 associated with the Thai Rock restaurant cluster, and 8 cases associated with the Batemans Bay Soldiers Club. The sequencing of the virus has helped us understand that they're all a strain similar to that circulating in Victoria. Now, that's important to note that we don't think they're all from the one person. What they represent is that the virus is similar, and we believe that there were different sources of exposure. We believe that we've identified the source exposure in relation to the Crossroads Hotel. We haven't yet done that with the Thai Rock. We haven't found that missing link, and we may never do that. But we have, and in relation to the Batemans Bay Soldiers Club, we're also continuing to look for the source of infection. In terms of the isolation period, there's been some confusion around our recommendations, and just to clarify this is consistent with what we've been saying. Because we've wanted to take a very precautionary approach in this response, we've actually asked people to come forward to get testing in circumstances, even if they've got minimal symptoms and in some cases no symptoms. That's because we've wanted to detect those cases early to give us all the lead time, because we know we can detect the virus before people develop symptoms in that period before, and hopefully before they've been out and about too far. So that's been really useful. But it doesn't, even if those tests come back negative on individuals, if you've been exposed to COVID in those settings and we've asked you to isolate, it is essential that you do so. We don't take that decision lightly, but it means that we've assessed you as having sufficient enough contact for you to be in a high-risk category of coming down with COVID. And at this important time, we want to stop those chains of transmission in the community. So this is consistent. Close contacts have always been required to be in isolation for 14 days from their last exposure and contact with that person, or being present in that venue where we know transmission has occurred. And even if you test negative, if you develop symptoms 3 days later, we want you to get retested. because of the fact that you may test negative at a particular point in time and subsequently go on to develop COVID-19.